We've heard a lot from lawmakers this year about surprise medical bills and their efforts to stop them.
Texas passed SB 1264 to protect patients from surprise bills in emergencies or in cases where they had no choice of providers. But it only applies to roughly 16% of Texans with state-regulated health plans and people with coverage through state employee or teacher retirement systems. It does not apply to large employer-sponsored health plans or Medicare. Change there must happen in Washington. KXAN Steffi Lee looks at the limits of states' surprise medical bills law and what policymakers say needs to happen next.
They were fed up because consumers are fed up and legislators were fed up.
Members, it's time for more protections in these types of situations where patients do not have a real choice or the ability to protect themselves from the bills they never knew were coming.
What legislators were fed up with were expensive surprise medical bills.
It can happen in situations where you don't get to pick your doctor. So an emergency, you can make sure you get to a hospital and you know it's in your network, but any doctor in that hospital might not be. When you get these bills with prices that are much higher than you would have paid a network, and you didn't know until after the fact that person was out of network, that's what we call surprise medical bills.
A new law going into effect starting January 1st protects patients with state-regulated health plans from getting these types of bills. It leaves billing negotiations between insurance plans and providers. There is also an exception when a patient specifically chooses an out-of-network doctor knowingly.
There's no patient who's ever going to be backed into a corner and asked to sign away their protections and pay more when they have no choice.
But experts say what happened in Texas needs to happen on the federal level for other health plans.
The good news is the lawmakers here in Austin have done everything they can to protect consumers. The bad news is the way the law works is they simply can't write laws that affect plans that are regulated at the federal level. And so we need Congress in Washington, D.C. to act to pass something that's similar to what we've done here.
Steffi Lee, KXAN News.
Senate Bill 1264 also requires the Texas Department of Insurance to study the impacts of this law every other year. The department will consider the bill's effect on consumers and trends in health benefit coverage in Texas.
If you get a surprise medical bill, the Texas Department of Insurance may be able to help you out. On its website, there are questions to answer to direct you on where you can get help. If you're one of the 16% of Texans with a state-regulated plan, it may be able to help with mediation for you. If you got insurance, though, through your employer or Medicaid, you'll be directed to the U.S. Department of Labor, where you can request assistance from a benefits advisor.